Oh, no. Okay, HIV, human immunodeficiency virus. Currently, there's 33 million people living with HIV, and there's 2 million HIV-related deaths per year. So, what is HIV? It is a retrovirus that causes immunosuppression, making persons susceptible to infections. And when I say retrovirus, because they replicate in a backward manner, going from RNA to DNA. The RNA virus binds to a specific CD4 cell. And you can see there's a picture here where it's binding to the cell. And the CD4 cell, or T lymphocytes, is your helper cells, right? So it binds to that cell, and it creates immune dysfunction, because your T cells are your helper cells, right? They're your fighter cells. The immune problems usually start when your CD4, your T cells, drops below 500. And then severe problems develop when they drop below 200, because your normal range is 800 to 1200. And then insufficient immune response allows for opportunistic diseases. So how is it transmitted? So we know a little bit more about it. So how is it transmitted? It is fragile. It is a fragile virus. It's transmitted through contact with bodily fluids under specific conditions. So blood, semen, vaginal secretions, breast milk, sexual contact with an infected partner is the most common mode of transmission. So blood, semen, vaginal secretions, and breast milk. Star that. I know that. And then perinatal. So often you can, the mom can transmit to the baby. It can occur during pregnancy, delivery, or even breastfeeding. So an average of 25% of infants born to the woman with an untreated HIV will contract the infection. And treatment can reduce the rate of transmission to less than 2%. So I have a story here. I had a friend who was married, 12 years. They couldn't conceive. She wanted a baby. So they did the foster to adopt. And she's a nurse, and they gave her an HIV baby. Well, the mom was HIV. And they weren't sure if the baby was. It was brand new, right out of the mom, brand new baby. And she ended up having to take the baby, to all these appointments, testing, and all this other stuff. And she ended up applying to adopt the baby. The mom ended up passing away, and she got to actually keep the baby. Well, the mom had taken the art therapy, or the medication, for HIV, and the baby never got AIDS, never got HIV. So she is now a 12-year-old child who you would never know. You never know. She's got two loving parents. You never know that she, was born to a mom who was addicted to drugs and had HIV. So it's a good story. So, having said that, if the mom takes the medication while she's pregnant, a lot of times the baby won't get HIV. So, just remember that. So let's talk about viral load. So viral load is the amount of the virus in the blood. And as you can see here on this graph, it goes up between 2 to 4 weeks. And if you notice, someone with HIV can transmit it to others within just a few days after becoming infected, and they don't know they have it. So that's, you see how that viral load goes up, but they're not necessarily symptomatic. Transmission of HIV is subject to the same requirements as other microorganisms. You have to have a large enough amount of the virus to enter, to be susceptible. We were, but the reason why I even kept this graph is because it just, I like the way it shows how, you're immediately, as soon as you get the virus or you contract the virus, you're pretty much, you've got a high viral load within the first, it just goes up, first 2 weeks. So you can actually spread it to others and not even know you have it. Okay, so HIV is not spread through casual contact. Not hugging, not dry kissing, not shaking hands, not sharing eating utensils, and not using toilet seats. All right, so this is kind of a timeline for an untreated, and I marked untreated person. Nowadays, there's treatments, everybody's getting treatment, but, when people first started having it, and then some people, still choose to live, ignorance is bliss, so they won't go get tested. But this is kind of a timeline for an untreated person. So you've got the acute infection, the first 1 to 3 weeks. So that was that, going up, acute infection. So then as your body recognizes and tries to fight, then you're going to get an asymptomatic infection for 3 weeks to 3 months. And then a little bit longer, after 3 months, you might start seeing some symptoms, and then it can turn into full-blown AIDS. But you see down here at the bottom, it can take years to turn into AIDS. See? So it turns into like a chronic illness if left untreated. And we'll talk a little bit more about this, but I just, this is a great graph to show you. All right, I'm going to take away some of this so we won't get so much so fast. All right, you see how I put the page numbers there? The 9th edition is page 236. The 10th edition, page 222. I was doing some research. So that's why it's so important if you're taking care or if you're working somewhere where there's high-risk people, it's very, very, very important to make sure they understand that there is a window period that it can take several weeks to detect the antibodies, and it's 3 to 4 weeks is what the book says, but everybody's immune system's different. Somebody might have a very strong immune system and it may take a little bit longer, so that's why it just says it may take several weeks to detect antibodies. So, and just keep that in mind that there is a window period. And the rapid HIV test, like the home tests are rapid. Some of the tests, where they swab your cheek, those are rapid tests. And those are only detecting for the antibodies. They have some now that'll detect for both. But most of the ones you see, they're cheaper just to check for the antibodies. So they'll tell people, they'll say, if you test negative and you are high risk, then please come back for another test. If you feel like they might not come back for another test, then a lot of times they'll go ahead and do the EIA test, the immunoassay. And then home tests. The book says home tests they're recommended, they're good, but they're not as reliable because, again, they're just testing for antibodies. So you've got this high-risk person who decides, I'm just going to take a test at home, and then they don't come back. And before long, 5 years, 10 years, they're sick. So, so it's very important. Education is so important. And, we've come a long way, and they're doing more. You see a lot of education now. So it is, we are doing a good job with educating people. So the EIA, or the Enzyme Immunoassay, is a third-generation test, and it checks for antibodies. And then the rapid screens for antibodies, I already said that. And then if a person or if a patient repeatedly has positive antibodies, because you can also have a false positive, someone with lupus or some of the other autoimmunes can get a false positive. So if they keep getting false positive, or if they keep getting positives, they'll definitely do a Western blot to just confirm it. And it checks antibodies and antigens. But there's so much new information out there. And they have come up, that's what your new book, your 10th edition, talks about 4th generation EIA test. That's the only difference is your 4th generation test includes antigens and antibodies. So I was reading a research article that said, the Western blots obsolete now because of the 4th generation EIA. But they still will do the Western blots because it just depends on the lab. So the 4th generation EIA includes antibody and antigens. And it's usually repeated 4 to 6 weeks for someone that's increased risk. Because again, you have that window period, right? So if you're taking care of someone and they come in and they get this test done and they're negative, they're going to tell them to come back for another test. All right, so diagnostic studies as far as progression. So progression's monitored by your CD4 T cell counts, right, and your viral load. CD4 T cell counts provide a marker of immune function. And then often, abnormal blood tests are commonly caused by HIV opportunistic diseases or complications of therapy, like the drug therapy. So decreased white blood counts, altered liver function. The reason why they even do a viral load test, because it can help provide staging of the infection. Like, where's the person at? Are their counts 800? Are they 300? Are they 100? So it helps provide staging of the infection. Because you're wanting to see how their immune function's going. How are they doing? How are they fighting this? Are they fighting it? So a lot of times, as far as clinical manifestations, what are you going to see? What is this going to look like? Well, acute infection it can occur up to 2 to 4 weeks after infection, but it's just basically sounds like the flu. Sometimes a rash. So acute infection is just flu-like symptoms. That's why a lot of people don't even know they have it. And then asymptomatic infection, that's that, if you think back to that graph, that's that chronic stage where it can be 11 years before they even get diagnosed. It'll turn into full-blown AIDS. But fatigue, headache, low-grade fever, night sweats. PGL is a very long word. Persistent, generalized, lymphoidopathy. Lymphoidopathy. So, swollen glands. Persistent. So, most are not aware, and then they continue their risky behaviors, causing a serious public health problem. All right, so symptomatic infection. This is when their counts start dropping 200 to 500. So your viral load increases, your body's not fighting it as good, and your viral load increases. So your symptoms seen in the earlier phases become worse. And you can have other problems develop, and we're going to talk about those other problems. But your HIV advances to a more active state. So, what is AIDS? AIDS, there's a great box in your book, but its CD4 count drops below 200 or an opportunistic infection. We're going to talk more about it, but I would know the difference between an opportunistic infection and just an opportunistic complication. So we're going to talk more about it. But they're all listed there in that chart. So your age criteria require at least one or the other. So a lot of times they're at greater risk for opportunistic diseases, such as fungal, viral, bacterial, cancers, and protozoal. They're at greater risk for possible malignancies, your lymphomas, your Kaposi sarcoma, where they have the spots on them, wasting, where they just lose so much weight, and dementia. So these are all complications in your actual, as you're starting to see AIDS. Diflucan is a medicine that treats thrush or any kind of yeast infection. Sometimes they'll give you that magic mouthwash that has it in there. And don't swallow it. Or sometimes you do if it's in your throat. So this is just a complication. But it can turn into an infection. It can turn into a lung infection when their CD4 counts are so low And then your infection is what? Infection is your criteria for AIDS, right? Not just because they have thrush. They might just have HIV. They might just be immunocompromised if they have thrush. Does that make sense? No? CMV. That is an infection. That is a criteria. Retinitis, retinal lesions, esophagitis. So CMV is another virus that can attack the eyes, the lungs. And then you can have protozoal infection, toxoplasmosis, and there's some others listed. Bacterial, TB. And then MAC is avium, Mycobacterium avium complex, which is like TB. A lot of times they mistake it for TB, but it's not TB. But it's very similar. It's just not, it's not contagious. But TB is very contagious. Tuberculosis. Cancers, invasive cervical cancer. KS is Kaposi sarcoma. There's some other lymphomas listed. So all of these are opportunistic infections and complications. Wasting syndrome, that's where they lose so much weight. Loss of about 10% of their body mass, of their ideal body mass. Wasting syndrome. Pneumocystitis jirovecii pneumonia. That is another infection. They can have cough, fatigue, fever. Treat it with sulfa and corticosteroids. A lot of times, someone that is getting these infections, or if they get this, they'll sometimes be on a prophylactic treatment of meds when their CD4 and their T cells drop below 200. So not only are they on, we're going to talk more about the retrovirals and stuff, they're on those, but as they start getting sicker, they may be on antibiotics, corticosteroids, they may be on other meds just to combat some of these infections. Because a lot of times people don't die with AIDS, they die with one of these, right? They die with cancer, they die with TB. Oh, okay, I made some arrows here. Oh, and I made more. Oops. All right. So, yeah, I've got the different page numbers. So you want to think about the thrush being a complication, and the infections, your pneumonia, your retinitis, your CMV as infections. So just know the difference. All right, now we're going to talk about drug therapy. So your antiretroviral therapy is often started as soon as the HIV diagnosis is made. So it's started before it turns into AIDS. Because like I said, a lot of these drugs will help prevent the virus from replicating. They have different actions. But it will prolong the time a person is in the HIV stage. So disease progression. It helps with prevent opportunistic infections or diseases. And this has to be individualized, very individualized, based on people's viral load, their cell counts. But the thing is, it has some complex side effects. It's a complex because sometimes they have to start other things if it's not working for them, if it's not helping their numbers. They may have to start other meds. You know, these meds have side effects, and it just does not work for everyone. Some people, it doesn't help, and it's very expensive. So once somebody starts on this, they have to be committed. They have to be ready. Because what happens with these drugs is if they skip a dose, then resistance is very rapid with these drugs. So if they skip a dose, then, or skip, some doses or whatever, your body works up a resistance to it, and then you can't take that medicine anymore because it's not working for you. So, you got to think, same thing. If they're not compliant, if they're not ready, then it's really just going to wear you out and them out because they're not, it's not going to be helpful. And a lot of these ART drugs have potentially lethal interactions with other commonly used drugs and like herbal remedies. So they have to be very careful. Again, a lot of teaching. Yeah, no St. John's Wort again. That's in your book too. St. John's Wort is a very if you take St. John's Wort, that's all you can take, okay? You got to make a decision. You're going to have to go on some real Prozac.
Yeah, it's like Prozac and
all the herbs are, you have to take a lot of herbs. I mean, the herbs, you have to really know your herbs to take them. It really doesn't work. You either have to do one or the other usually. You can't do both because the things interact. So you may hear this called art therapy. You may even hear it called heart therapy, but it's very similar. It's just a combination of drugs that they use to help prevent HIV to progress into AIDS, suppresses the HIV replication, and it decreases if you put a combination. It decreases the likelihood of drug resistance. So it's like pow. Like big guns.
Yeah. It's a cocktail.
Yeah.
Especially dose 6 or 7.
Yeah, it's very complex. Yeah. I was reading in your new book that so your main goals: decrease your viral load, prevent HIV-related symptoms, delay disease progression. Prevention is the key. So that's why they hand out condoms at every health department. You want them to prevent HIV. And onset can be delayed with adequate measures. And effective management has significantly increased life expectancy. Like Magic Johnson, he was diagnosed, what, in the 80s, in the early 90s? And he is still alive. So,
It's technically free.
huh?
It's technically not even HIV anymore.
I know. It's amazing. I mean, that, money will buy you a lot of things. The best care money can buy. All right, so let's talk about collaborative care. So you're going to monitor the disease progression. We've talked about that. Lots of blood work, to monitor immune function. You're going to manage symptoms. You're going to initiate and monitor the ART therapy. Prevent and treat opportunistic infections. Prevent further transmission. Prevent complications of therapies, such as your medication side effects. All those side effects corticosteroids can cause, antibiotics, things like that. And prevent further transmission. Prevent or decrease complications of therapies. I have prevent further transmission twice. So that's very important. That's very important. It's on there twice. And then support group. So a lot of these people, they experience social isolation, right? Because even though we've come a long way, we have. But you definitely, want to prevent further transmission too. So a lot of education, teaching them about using condoms, teaching them about how it's, how it's passed to one another. And then definitely finding a support group so that you can help prevent social isolation. And, just making sure education is, knowledge is power. So if they, making sure they know the facts is very important. Avoid, this is probably a review. Most of y'all know all this, but avoid risky behaviors. What are risky behaviors? Unprotected sex. Well, AIDS-related, HIV-related. So, using IV drugs, right? Illegal. So, drug use, risky behavior, sexual behavior. And if they are doing that, they need to modify it. Sometimes it's important to have a candid, culturally sensitive language, a conversation with someone. You have to be, be mindful of language appropriate, age specific, and behavior counseling. I worked for a little while in a small rural health department. As far as decreasing the risk, we talked about perinatal transmission, making sure they take the antiretrovirals, family planning at your local health department, or even at your local OBGYN, making sure that they're using protection and getting tested, and then appropriately medicate HIV infected pregnant women. Health promotion, prevented at work. So, we all, as medical professionals, will be at risk. So you want to make sure universal precautions with everyone. If you ever notice, you don't put a sign on a HIV patient's room like you do the MRSA rooms and stuff, although HIV is not the same, contract is the same, but what I'm saying is use universal precautions with everybody. Adhere to precautions and safety measures to avoid exposure. Again, I say We follow the rules for a reason. You get in the habit of following rules and you protect, you will protect yourself. Report all exposures in a timely manner. If you are exposed at work, you need post-exposure prophylaxis with a combination of ART therapy. It can significantly decrease your risk of infection. I will say this. So HIV is just like any chronic disease. It requires acute intervention at times. There may be hospitalized. They may need hospitalizations for the infections, for complications related to the medications, and then supportive care. It causes a physical disability and social, emotional, economical. It's very, like I said, the medicines are very expensive, and spiritual well-being. Patient and family members have to deal with the stigmas because even though the patient might have it, the family members sometimes even, might carry a stigma for them. People might think, oh, they live in the same house, they could have it, And then again, support group is very important. So, on this slide, I want to make sure that we talk about, under the physical disability, I want to make sure you realize that a lot of times they may be, as they are getting sicker and their counts are going down, what would that look like? They may be weak, right? Fatigue, that kind of thing. So, they may have to... They may have to do things to conserve energy. They may not be able to go walk around the mall or go shopping. They may have to conserve their energy. They may have to, say they have things they have to do around the house. They may have to fold clothes or do whatever, but sitting down, to provide for them the rest that they need so that they can use their energy for other things. So just keep in mind that they will be weak, especially as their counts go down, and they may require some adjustment. They're not just lazy or whatever. So they may require sitting for activities. All right, and then testing is the only sure method of determining HIV, right? The CDC recommends universal voluntary testing for everyone from age 13 to 64. And then an estimated 21% of people living with HIV are not even aware that they have it.